In Summit Rounds this morning, Dr. Robin Oakey talked about opioid safety, and he highlighted some really, really good points that I think all of our patients should know. If you want to have access to the full content that he shared with us, it's available in the Summit Medical Institute app. Did you know that if a patient takes an opioid for 1 day, they are at risk of being on an opioid at 1 year of 6%, and of being on an opioid at 3 years of 3%? That's just after 1 day of use. If a patient is on an opioid for a second script, or if they have opioid use past 5 days and past 30 days, or if the cumulative dose of opioid is over 700 morphine equivalents. All of those things are also associated with a chronic use of opioids. We know from the literature presented by Dr. Oakey that patients that are on opioids for 1 to 6 months have maybe very modest benefits, if at all, from the opioid. And they definitely have some harm. The literature going past 6 months says that there really may not be any benefit, but there is definitely harm. So the take-home message from this is we don't want patients to be on opioids for extended periods of time. We want them to be on at the smallest effective dose for the shortest period of time. And we want patients to recognize that any exposure to opioids does have a small risk of becoming dependent on them or to be using them for long periods of time. And we really want to avoid that. One misperception that was highlighted in our conversation is that tramadol is an opiate. And it is one of the opiates that's commonly used chronically. And that could be because patients don't perceive it as being an opiate. Of the opiates that are used chronically, the long-acting ones are the ones that patients have the hardest time getting off of. But tramadol is the second most common long-term use opiate. And so I think it's important to take that into consideration. One final thing that was brought up is the rate of opiate overdoses in the United States. Now, the risk cumulatively, or the rate of overdoses of any kind of medication or drug, cost over 100,000 lives in the United States in 2021. This was the first time that that number had been reached ever. Of the overdoses, over 80,000 of them were from opiates. And what we are seeing lately is a sharp increase in the number of fentanyl-related overdoses. We didn't used to see fentanyl as a cause of overdose deaths nearly as much as we are seeing it now. One of the things that happens is patients get on a prescription opioid and then for one reason or another end up taking an illicit drug like fentanyl off the street, knowingly or unknowingly, and then they have an overdose related to that. So it's just very important that we recognize opiates as something that we need to be very cautious about, and that even short-term exposure to opiates can lead to long-term use.